Terazosin Hcl is a medication used to treat high blood pressure, which can help prevent strokes, heart attacks, and kidney problems. It works by relaxing blood vessels to make blood flow more easily. It is also used in men to treat the symptoms of an enlarged prostate, such as difficulty in beginning the flow of urine, weak stream, and the need to urinate often or urgently. Terazosin Hcl does not shrink the prostate, but it works by relaxing the muscles in the prostate and part of the bladder. This medication belongs to a class of drugs known as alpha blockers. It can be taken alone or with other drugs, and the dosage and timing should be determined by a healthcare professional. Before you start taking terazosin, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food, usually once daily at bedtime. If you are taking terazosin for the first time, do not take more than 1 mg to start. This is to avoid a sudden drop in your blood pressure, which could lead to dizziness or fainting. Your doctor will start you on a low dose and gradually increase it based on your response to treatment. It's important to take this medication regularly at the same time each day to get the most benefit from it. If you miss taking terazosin for a few days, you may need to restart treatment at the low dose and gradually increase your dose again. If you are taking this medication for high blood pressure, keep taking it even if you feel well. Most people with high blood pressure do not feel sick. If you are taking it for an enlarged prostate, it may take 2 to 4 weeks to see an improvement in your symptoms, and up to 6 weeks before you see the full benefit of this drug. Tell your doctor if your condition does not improve or if it worsens. Some common side effects of Terazosin Hcl may include dizziness, lightheadedness, tiredness, nausea, drowsiness, blurred vision, headache, or stuffy nose. To reduce the risk of dizziness and lightheadedness, it's important to get up slowly when rising from a sitting or lying position. Remember, this medication has been prescribed because your doctor has judged that the benefit to you is greater than the risk of side effects. Many people using this medication do not have serious side effects. However, it's important to tell your doctor right away if you experience any serious side effects, such as fainting, fast/irregular heartbeat, burning/tingling in the hands/feet, sexual function problems, swelling of the ankles/hands/feet, unexpected weight gain, or a painful or prolonged erection lasting 4 or more hours. If this occurs, stop using this drug and get medical help right away. It's also important to be aware of the symptoms of a serious allergic reaction, including rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. If you notice any of these symptoms, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. And remember, always consult your doctor before starting or stopping any medication. Before taking terazosin, it's important to let your doctor or pharmacist know if you have any allergies. This medication may contain inactive ingredients that can cause allergic reactions. It's also important to discuss your medical history, especially if you have low blood pressure, fainting, or certain eye problems. Terazosin may cause dizziness or drowsiness, especially when combined with alcohol or marijuana. It's important to avoid driving, using machinery, or any tasks that require alertness until you can do so safely. It's best to avoid driving or hazardous tasks for 12 hours after the first dose, after your dose is increased, and when this medication is restarted after it has been stopped. Limiting alcoholic beverages is also recommended. If you are using marijuana, it's important to discuss this with your doctor. Before having surgery, including cataract or glaucoma eye surgery, it's important to inform your doctor or dentist if you are taking or have ever taken this medication, as well as any other products you use. Older adults may be more sensitive to the side effects of this drug, especially dizziness, fainting, and low blood pressure when getting up from a sitting or lying position. These side effects can increase the risk of falling. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. It is also important to consult your doctor before breastfeeding while taking terazosin. It's important to be aware of potential drug interactions with Terazosin Hcl. This medication may interact with other alpha blocker drugs, as well as drugs used to treat erectile dysfunction or pulmonary hypertension. This can lead to a drop in blood pressure, causing dizziness or fainting. It's important to talk to your doctor about all the products you are using, including prescription/non-prescription drugs and herbal products. Additionally, some products may contain ingredients that could raise your blood pressure, so it's essential to speak to your pharmacist about using them safely. Always follow your doctor's instructions and do not start, stop, or change the dosage of any medicines without their approval. If you or someone you know has taken too much Terazosin Hcl and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the Poison Control Center at 1-800-222-1222, while Canada residents can contact their provincial poison control center. Symptoms of overdose may include severe dizziness and fainting. It is important not to share this medication with others. If you have high blood pressure, making lifestyle changes such as exercising, quitting smoking, and following a low cholesterol/low-fat diet may help this medication work better. It is important to consult your doctor for more details. While taking this medication, it is important to have your blood pressure checked regularly. You can also learn how to monitor your own blood pressure at home and share the results with your doctor. Additionally, while taking this medication, it is important to have lab and/or medical tests, such as prostate exams and blood pressure checks, done. It is important to keep all medical and lab appointments and consult your doctor for more details. If you forget to take a dose of Terazosin Hcl, take it as soon as you remember. If it's close to the time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take 2 doses at once to make up for the missed one. For more information on how to use Terazosin Hcl, refer to the How to Use section. Remember to store Terazosin Hcl at room temperature, away from light and moisture. Avoid keeping it in the bathroom and make sure to keep it out of reach of children and pets. When it's time to dispose of the medication, do not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, properly discard it when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for guidance on how to do this properly. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.